Clinical practice guidelines are designed to improve quality of care. However, there are practical challenges around the ways they are developed, disseminated, and used. Every year, many new CPGs are developed and made available to healthcare providers in Canada. But if those best practices are so widely available, why aren't all providers using them?
There are actually literally thousands of CPGs out there, and often many on the same topic.
At one level, there are now many guidelines being developed, and clinicians feel a bit overwhelmed by the number of guidelines coming through, many of which may not be high quality.
There are 76 randomized clinical trials published every day. There are another 11 systematic reviews every day. Just in the time we're going to spend talking together, I'm behind if I don't have access to clinical practice guidelines.
Then there's the issue of whose CPG do we follow?
There are a number of efforts nationally and internationally to collect CPGs in one place. The Canadian Medical Association, for example, maintains one of the largest online CPG repositories in Canada.
Infobase is a Canadian database for Canadian physicians. We have almost 1,300 clinical practice guidelines in our database at the CMA. It's publicly accessible, so anybody in the country can get to it.
Typically, these large repositories are continuously monitored to house the most up-to-date guidelines. However, one of the challenges is that not all CPGs have been developed with the same level of rigor.
So the question really is, who does make them? And the answer is a widely disparate group of folks make them up. Some very skilled who do a number of clinical practice guidelines and are methodologically very sophisticated, and others are people who come together for a one-off and don't have that same degree of experience. And we know that we do in fact have guidelines that are less than stellar in our database. They're there because they're the only Canadian guideline in that area. But we have to be aware that there is variable quality.
Not all guidelines are created equally, and that's a very important lesson to learn. There are very strict criteria for what makes a good guideline and what makes a guideline that you may not be able to trust. The most important thing was how it was developed. Was there a rigorous process with independence of the developers, a thorough review of the existing literature? A lot of guidelines don't have that same research ethic to them or rigor.
To address this issue, evaluation tools to rate the quality of CPGs are available.
We have an evaluation tool called Agree, which allows us to make an assessment about the quality of a clinical practice guideline and whether it's likely trustworthy and should be implemented in practice.
CPGs provide a guide for healthcare providers who must use their own clinical judgment to interpret them and ensure patients get the most suitable care.
I think the most important thing to emphasize is that it's exactly what it says. It's a clinical practice guideline. It's not a rule, it's not a law, it's not a regulation. It's guidance about making a decision.
It's also important to understand that CPGs exist on a spectrum, from fairly absolute and specific to highly discretionary and general.
Il y a des lignes directrices qui vont s'appliquer au suivi des maladies chroniques que le patient présente. Alors, c'est des lignes directrices qui sont assez absolues en termes de ce qui doit être fait dans un monde idéal. Mais il y a aussi d'autres lignes directrices qu'on pourrait qualifier d'un petit peu plus discrétionnaires et qui s'appliquent à la prévention et qui viennent un peu s'ajouter à la tâche des intervenants de première ligne.
Another common challenge for healthcare providers occurs when using CPGs for patients with multiple medical conditions.
Clinical practice guidelines generally are structured around the individual disease, but patients may have more than one disease, and the treatment for one may make one of the others worse. So there's a real challenge out there in making clinical practice guidelines that are actually based on types of people as opposed to diseases.
Une autre difficulté, c'est que des fois, il y a des recommandations qui sont contradictoires. Okay? Par exemple, une ligne directrice qui demande à des patients de faire l'exercice, mais en raison d'une autre maladie que présente le patient, il y a une impossibilité de faire de l'exercice, ou encore un patient à qui on doit prescrire un médicament, mais le médicament est contre-indiqué pour une autre maladie que présente le patient.
Another challenge is system capacity. The current healthcare system doesn't always provide all the services required for clinicians to follow what is recommended in the CPGs.
Some of the things we know to be effective are not always easy to implement. For example, one of the recommendations of a Canadian Cardiovascular Society heart failure guideline is to perform echocardiography on a regular basis. And not all communities have access to echocardiography on a regular basis.
One of the things you hear said frequently is our health system isn't sustainable. What happens if a clinical practice guideline is spot on the money for what should be done, and it's horribly expensive?
Et donc, une espèce de contrainte de fait qu'un même guide de pratique va être soit trop générique pour être directement applicable pour l'ensemble du Canada, ou les guides de pratique plus spécifiques, plus opérationnels, vont avoir plus de difficultés à s'opérationnaliser. S'ils sont bien opérationnels à un endroit, ça ne veut pas dire qu'ils vont être très opérationnels à un autre.
As you can see, there are challenges and complexities that affect the widespread use of CPGs, like the varying rigor of guideline development, the importance of clinical judgment, and the overall capacity of the health system to provide the care recommended in CPGs. To learn more about the Health Council of Canada's video series on CPGs, visit healthcouncilcanada.ca/CPG.